The topic today of the discussion, we have a distinguished guest who will be talking to you about how to keep your feet happy and healthy without any pain. Problems that can take place in the feet from conditions such as diabetes or other type of neuropathies. We call them neuropathies, and you feel burning sensation, numbness, tingling in your feet. And of course, sometimes if you have a back pain, if specific nerves in the back are compressed, are pinched, you may feel no pain whatsoever in your low back, but because that nerve is being pinched, you may feel numbness, tingling in the feet, and sometimes even weakness. All right. So one of the tests that we do to identify this type of problems is electromyography and nerve conduction studies. These are tests that we do, and we gave you some literature in your packages, in your pamphlets. These are tests that we do that can, with quite a bit of precision, identify a nerve problem in the feet or around the feet. And also, we use new technology without the use of radiation or exposure to radiation, which is called musculoskeletal ultrasound, where we can evaluate the structures of the feet, including the nerves. So these are valuable type of tests that we perform, and if anybody has any issues with their feet and need this type of testing, we'll be happy to talk to you about it. I would like to introduce you to today's guest. It is Dr. Ryan Minara, who is a doctor of pediatric medicine. And Dr. Minara attended the New York College of Pediatric Medicine, and he has done a very rigorous surgical residency in pediatric medicine and surgery at New York Hospital of Queens, where he was the chief resident. And you know, for someone to become a chief resident, really need to be the best of the best.
Our website is healingfeet.com. We have an excellent blog on there and a lot of information about foot conditions. There's so many things that could possibly affect the foot that I really just chose a few main things to talk about tonight, sort of the most common types of injuries. So some interesting facts. They say the average American walks 18,000 steps a day, but that's actually Snapple telling us that. You know those little facts on the bottom of the cap, so I learned that from Snapple. They sort of overshot it a little bit. The American Podiatric Medical Association did some tests, and they say it's actually between 8,000 and 10,000 steps a day, which is about 5 miles a day. And over the course of an average lifetime, that's 115,000 miles. That's 4 times the circumference of the Earth. So you could walk around the Earth 4 times in the course of your lifetime. About a quarter of all the bones that are found in your body are located in the foot. And the total forces, you know, the amount of pressure that you're putting on your foot each day can equal several hundred tons sometimes, about the weight of a fully loaded cement truck. About 75% of all Americans will develop foot problems in their lifetime. And I'll be honest with you, I think it's probably higher than that. I think 75% come to see me or come to see a podiatrist when their feet hurt. I think the other 25% convince themselves that foot pain is okay and that it's normal. And I want you guys to know that it's definitely not. Something as small as a 2.5-inch heel can increase the amount of pressure that we put on the front of our foot by 75%, which is crazy considering all the forces that we put on our foot, as we talked about in the last slide. My first little tip of the day is be wary when you're buying shoes. When you wake up in the morning, that's the best your foot are going to feel and look, okay? If you buy shoes then, they're not going to fit you right. You got to wait until the middle of the day when they're a little bit swollen, because everybody's feet swell a little bit and sort of expand as they're walking, okay? If you wait too late at night, then they're going to be too loose overall. Also, it's very common for feet to be slightly different sizes. So when you're getting your feet measured, which you really should when you buy a shoe, especially if, at least once a year, because feet do change, measure them both. Another important thing is measure to the longest toe. Everybody seems to measure their foot to the, they lift up the big toe and they say, oh, that feels good. But for most people, the second toe is the longest toe, and they start getting hammer toes or nail problems with their second toe, and that's a toe that they should be measuring to. And don't just measure the length, make sure you do measure the width. because another big problem is that people wear shoes that just aren't wide enough for their feet. And I deal with a lot of athletes, so the foot will adapt to training surfaces over time. So if you are training for a marathon or you want to start running for exercise, you have to be very wary of the surface that you're running on. Some people always run on a treadmill and they say, you know what, I want to go out and I want to run in the park, I want to run on the streets. It's a very different surface, and you can overdo it and hurt yourself depending on the surface that you're running on. Same thing can happen in reverse. You can go from a much harder to a softer surface and start getting muscle injuries or fatigue based on that. So it's always important to gradually increase your activity when you're changing surfaces. Something can happen, you drop a bowling ball on your foot, you get in a car accident, that's an acute injury. Or what we call a sudden overload. You step off the curb funny and you roll your ankle. That's something that happens and there's an immediate response to that. And then there are chronic injuries, which is essentially tendons or muscles or anything wearing out over time. So it can be a very insidious process, meaning it starts, it's a little stiff, it hurts a little bit today, and then gradually it builds up because people don't take care of it initially, okay? So if you have stiffness in your joints, if your muscles sort of spasm or get weak or cramp, if you have altered sensation, the inside of my toe is a little bit numb, this area feels funny, and it's only one localized spot of my foot, it's something that you want to get checked out sooner rather than later. There might not be anything wrong, it might just be a transient thing, but there might be something that needs to be looked at so that we can help prevent you from developing problems in the future. It's really, again, making sure that you're choosing the right shoe for yourself and making sure that you're always gradually increasing intensity. A lot of injuries occur more for intensity of, say, training or intensity of running rather than the amount of running that you're doing. Although if you try to run 20 miles, even very slowly, after never having run, you're still going to get hurt. So you can have symptoms in other parts of your body that can be directly related to your foot or vice versa. You can have structural deformities that are coming from your hip or knee or back that can lead to foot issues. You can have foot issues that can directly relate to knee, hip, or back issues, okay? Because sometimes we can alleviate back pain or knee pain or hip pain just by wearing the right shoes or wearing the right inserts. A lot of other times it's these guys who are doing strengthening exercises for certain muscles that will compensate for some of these postural deformities, okay? You can always find a place where they do gait analysis. Even some sneaker stores, Jackrabbit, Super Runner stores, sometimes a lot of physical therapy places. We have one in our office, which is on the right, where we can put you on a treadmill and measure the amount of force that you're putting on your feet, how much time you're spending on each foot. We can actually videotape you as well. So that'll give us slight, that'll be able to pick on slight things. In other words, do you have a limb-like discrepancy that we haven't, it's so small that we can't measure it? Is one side stronger or weaker than another? And then we can sort of develop a plan to get you back into sort of top-notch if we know exactly what's the problem, if it's something very slight or imperceptible. The most common cause of heel pain is something called plantar fasciitis. Have any of you here heard of plantar fasciitis? You've heard of it? Has anybody had it or knew somebody who had it? It's a very common problem. Almost everybody has either had it at some point to some degree, or they know somebody who's had it. It's a real pain in, well, the foot.